Abnormal uterine bleeding is bleeding between monthly periods, or it's prolonged bleeding on time of periods, or it's very heavy bleeding. Abnormal uterine bleeding can happen due to fibroids, endometrial cancer, or endometrial polyps, or some hormonal changes in your body. Adenomyosis can also be a cause of heavy or abnormal uterine bleeding. Abnormal uterine bleeding is most commonly from fibroids, myomas. Over 35 years of age, many women can have fibroids. If the fibroids grow very close to the inner lining of the uterus, then bleedings are the most common symptoms. Irregular proliferation of the endometrium might cause endometrial polyps. This is also a cause of abnormal uterine bleeding. Women with hormonal imbalances, this can be uncontrolled diabetes, this can be thyroid problems, or estrogen or progesterone related problems can also cause abnormal uterine bleedings. Heavy or prolonged bleeding is also a symptom of endometrial cancer, and it can be diagnosed with endometrial biopsy. When we diagnose a patient with abnormal uterine bleeding, we just first evaluate the causes of abnormal uterine bleeding. If the cause is a fibroid or an endometrial polyp, then the surgery is a cure for this patient. When the myomas or the endometrial polyps are removed, then the symptoms will vanish or will disappear. If the patient doesn't have an organic cause like fibroids and polyps, which can explain the abnormal uterine bleeding, then hormonal treatment can be an option for this patient. Hormonal treatments can differ. We can just give oral progesterone treatments. We can replace a progesterone releasing intrauterine device. We can give you injectables to help with your symptoms. In young cases, birth control pills can also resolve your problems. Hysterectomy is an option for women older than 40 years of age for abnormal uterine bleeding who do not wish to get pregnant anymore. In women who want to keep their uterus and suffering from abnormal uterine bleeding, endometrial ablation is also a treatment or surgical option for the patient.